Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
The American Society of Cancer says that every second man and every third woman in the world is going to get cancer. There is so much still that we do not know about it yet. There is the silver lining, though, that a lot of progress has been made in cancer detection if only we follow protocol. So today in our conversation, we'll try and understand why do we get cancer, how do we detect it early, and what is the cure. I'm sitting with someone who's perhaps an authority on this subject and an absolutely lovely individual to talk about. Please welcome on the program today. Joining me is Dr. Sewanti Limaye. She is the Medical Precision Oncology Director, Clinical and Translational Oncology Research at Sir H.N. Reliance Hospital. She's also the co-chair at Asia Pacific Coalition Against Lung Cancer. Thank you so much, ma'am, for joining us. Like I said, couldn't think of a better name to speak about this. But we are discussing cancer during the month which is about lung cancer awareness. You have done some tremendous work on it. So let me start with that and try and understand from you. In days like these, when a lot of non-smokers, healthy individuals are getting cancer, more and more younger people are getting lung cancer, what's the reason?
So first of all, Sonal, thank you so much for having me on your show. Lung cancer is not just seen in smokers. The incidence is growing in non-smokers is also a reality. The lung cancer that we see in India, in Asia is actually very different. We see large percentages of non-smokers' lung cancer in these parts of the world. And that's where the question comes in. What is exactly contributing to the causation of the non-smokers' lung cancer? Because up until now, we had only known smoking or secondhand smoking as one of the largest risk factors for causing lung cancer. But there is some data that is emerging that is really stark. In that it is air pollution, in that it is exposure to radon, in that it is exposure to certain kinds of carcinogens that are there not just in air but in our soil. Radon is one of them. And there are other carcinogens that are there in the soil, in the water that we drink, that are getting flagged off. But the largest or the biggest culprit that we have already almost recognized is the heavy particles that are there in the air. One of the last factors that cannot be ignored and should be paid attention to is there are certain types of cancers that run in families. Lung cancer also could run in families and is carried with a particular gene, especially BRCA2 positive people can be at a risk for lung cancer. And similarly, BRCA-like genes can be responsible for certain types of lung cancers. And so if there is a history of cancer in the family, patients definitely flag off as high risk and should be screened more than the routine.
The 5 or 4 points that you've mentioned as leading causes of cancer in non-smokers, I want to go into all of them. Let's begin with air pollution. PM 2.5, the particle matter that we cannot see, we cannot smell, it penetrates directly into your blood vessels. How much of exposure to this is actually causing lung cancer? Is there a definitive study to it?
ESMO 2022, I would say, or 2023, I'm blanking out on the year, but there was a 40,000 plus subject study presented by the first author is Charles Swanton. He is a celebrated researcher in United Kingdom. And Charles Swanton's study actually showed that particulate matter above 2.5 was found to be directly responsible for causing a mutation in people who were non-smokers. And these subjects were in the UK, who were non-smokers, were screened and found to have a higher predilection of EGFR positive lung cancer. And EGFR is a gene that is mutated in the cohort of people that I just described, non-smoker Asian woman. And here in India, I say non-smoker Asian man or woman. For US population, 8% of lung cancers were EGFR positive. What's the number in India? 23 to 27% of lung cancers, of adenocarcinoma.
So it's directly related to our air quality.
Directly related. I'd take a moment here to also flag off other insults to lung. So if someone has interstitial lung disease for their life, scarring of the lung post-COVID, big flag off.
You mentioned a very important bit about COVID and the relationship to lung cancer that you're seeing now. Of course, anecdotal evidence, because there's not been enough time for a full-fledged report. But what are you picking up from those who've had long COVID or severe COVID, and how cancer, and specifically lung cancer, is developing?
So it's a long known fact that scarring in lung could also contribute to lung cancer, right?
When you say scarring, what do you mean?
So there are people who have genetically driven syndromes where there are excessive production of sputum in the lung, and that leads to chronic scar formation.
Okay.
Or people who have interstitial lung disease, they also have chronic fibrosis in the lung. Those people could be at a high risk to long-term changes and long-term carcinogenesis or cancer causation or long-term effects leading to lung cancer.
Okay, so people who had patches in the lungs during
TB.
their COVID scans. Yeah.
So, previous TB or scarring related to TB leads to squamous cell lung cancer. It's a known fact.
Okay.
Previous years. Then comes COVID, long COVID, or even those who did not have long COVID but did have COVID enough to have scarred their lungs. Now, I want to put it on the table that this still needs to be validated completely. I don't have hard evidence, but we are also studying, and enough to flag off the fact that people who had bad COVID are presenting with lung cancers where they are non-smokers, and two, atypical type of lung cancer. So more squamous or adenosquamous in non-smokers where squamous should not have been seen. Squamous lung cancer is a smoker's cancer. Age-old history, this is how we have studied small cell lung cancer, and squamous lung cancer is a smoker's cancer. But we are seeing these now in non-smokers, in people who have no second-hand smoking exposure. And if you deep dive and take their history, they have had bad COVID. So it's not just squamous, but also adenocarcinomas of the lung, so-called non-small cell lung cancer, which is more predominantly seen in non-smokers. These type of lung cancers, if you take history, either you will get history of TB or COVID or some kind of a lung scarring, asthma. So we are flagging off these as high-risk features as we build on our screening measures, in addition to, of course, the history of smoking or secondhand smoking or radon exposure, asbestos, silic, wherein, we are a resource-limited nation. We can't screen the community at large. If you were to set out to screen the community at large, everybody in this room and outside and the whole globe, you just don't have that much money to screen all of us. So if we red flag the high-risk group, if we are able to red flag the high-risk group, that's when we'll be able to justify the resources that we can then put down to screen. At least those need to be screened. And that's when radon comes in. And what is radon? It is a gas that gets emitted. It's odorless. You really wouldn't realize that you are in a radon positive area. And these are emitted from soil or rocks, and mostly in closed old closed constructions. So people who live in less ventilated areas, who are old and have soil that has been there for a while, radon can develop there. So the idea is to ventilate. But then
This is only soil, or is this rocks, or is it
rock and soil both.
rock and soil?
Rock and soil both.
Not
So,
particular to any part of the country, any kind of soil, nothing.
so there are, if you Google it, you will get an epidemiological terrain as to what areas are radon rich. So one should definitely be aware of that. And especially in communities where you see more lung cancer happening, be aware. Figure out what could be contributing. Even the asbestos, silica exposure, and diesel. So as I screen, I'm red flagging all, taxi drivers, truck drivers,
Are you saying
smokers.
just the smell of
Just
diesel?
the smell of diesel puts us at risk. So I think we really need to be aware that people who are auto rickshaw drivers, people who are on the road, who are, commuting,
Traffic police.
traffic police, truck drivers, taxi drivers, all, even if we are on long drives, we have to be aware that if we have our windows down and there's a lot of traffic fumes as we drive, we are at risk. So smokers are definitely at risk, but non-smokers, people who've had bad lung issues, lung infections, those people, as we go along, as we age, cancer is a disease of aging, more genetic mutations happen as we age. And an insult that may have happened, say, a decade ago or a few years ago may amount to changes in the lung that could be carcinogenic. More evidence will play out, but till that builds in an imperfect time, in an imperfect world, still there is enough to flag off high-risk stratification and go screen.
Okay. But what's clear is that there is a direct relationship between air pollution and long exposure to bad air,
Yes.
so to say, that is causing. It's clear in the numbers, because the Asian region, where particularly we're seeing bad air come in compared to the West, where the numbers are rising.
There is a little bit of a flag off in terms of how to protect.
Okay.
So if you are involved or engaging in long drives in populated, busy, polluted areas, wearing a mask is a must. Inside the car, if you have complete everything locked in, don't open your vents. Opening the vent is directly taking the exhaust inside the car.
Yeah.
Having said that, there are many people who are not in air-conditioned spaces.
Yeah.
They are in auto rickshaws. They are driving trucks. They are driving taxis that have the glasses down. In situations where they're on a scooter, they're on a bike, there is direct pollution hitting them in large populated times, busy times of the day, when the traffic is bumper to bumper, we really need to mask up. It is the responsible thing to do, to mask up.
Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
At this stage, are there some early signs for people watching right now to prevent and to keep in mind, specifically looking at lung cancer?
So there are signs, but lung being an inside organ, something that is not outside, the signs do come in late. So for every little cough, one can't go and screen. That is why high risk identification becomes very critical. Those who are in these 6 brackets that I just outlined, they should be flagging themselves off, being more aware of their body and getting screened yearly, diligently, would be most critical. For the rest of us, prolonged cough, weight loss of any kind, excessive sputum production, blood in sputum. So if someone coughs and brings out blood, even a small particle of blood, they should flag it off. Chest X-ray is not enough. So if any one of these symptoms are there, they need to seek higher level of attention and be screened in a more in-depth way. Low-dose CT scan has to be applied, including people who are exposed to air pollution, including people who have family history of lung cancer, including people who have lung scarring from previous tuberculosis or have had COVID-related scarring in the past. All these people are red flagged. People who are working in areas where they are exposed or have been exposed in the past to silica, diesel, gas fumes, chemical fumes, or asbestos.
If you were to prescribe to aware individuals today who are worried and take their health seriously about tests to be gotten done, do you have a list that you can share with us?
So at Reliance Foundation Hospital, we are screening. And we offer screening for regular subjects. We also offer screening for high-risk subjects. So we have screening efforts put forward, funded by Federal Bank. We have a screening effort put forward for 1,000 subjects identified as high risk for lung. They are underprivileged and they have been flagged off to be screened with certain tests. So there are blood tests, there are low-dose CT of the chest, and there are clinical examination. We also are partnering with labs that offer liquid biopsy testing as a measure to identify. And a word about that as well, because I feel that that is what is going to be on the horizon, which is going to be a game changer.
Correct.
And I've been a part of this research for the last 8 years, as long as I've been in India. So liquid biopsy or circulating tumor material, circulating tumor DNA, circulating tumor cells, circulating tumor associated cells have been there for a long time in advanced cancers. In cancers which have already been surgically taken out, there's a lot of work happening and established that this material gets shed out in these patients as well. And a lot of work has already been done in diagnosing cancers early with circulating tumor markers.
Yeah. The bottom line here seems to be that you have to identify who's in a high-risk category, get them screened, there are enough options available, and then, go to a right expert to take it forward from there. But let's move to the other side of this conversation. Before we call it all doom and gloom and everybody getting cancer because of air pollution, what are the ways to keep cancer away? What are the ways to eat right, to exercise the right way, so you can avoid cancer? Is there something like that which exists?
Yes, I think a lot of efforts have come through in diet and exercise that need to be outlined, and that's the basic that we can all follow, right? So we are all for shunning processed food, not just for cancer, but all kinds of health ailment. One of the best diets till date in medical record, published, validated, followed by millions, is Mediterranean diet.
Yeah.
As Indians, we are already part following the Mediterranean diet. 3 things food-wise that is flagged off, big red flag, and should be shunned. Alcohol, smoking, and red meat, these are the major red flags. Sugar is still ambiguous. Dairy, still ambiguous. Other kinds of poultry, still ambiguous. But if you look at the Mediterranean diet, it was not some place where sugar was shunned. Processed sugar was shunned. So I think processed food across the board is something that we have to say no. So in an average plate, one should have some legumes. So if I'm talking about lunch, if you have chole rajma, if you have your bhindi bhaji, and if you have a millet chapati, and you have some pulses, dal, that's a great plate. That's some salad. That's a great plate to have.
Does this exist? Is there one particular fruit or diet that can cure cancer?
Actually not. I wish there was, and I explain it in my way to patients when they ask me for this. I say, you know, if I knew that doing just this would cure your cancer, I would be the first person to lock you up in a room and give you only that food for X amount of time, because I'm so invested in, you know, curing my patient. But actually, unfortunately, there isn't anything like that.
Right. Okay, as we close this chat, if you had to summarize in about a minute of people on how cancer can be prevented.
So 3 things that I already mentioned. If you're a smoker, quit smoking. Take help, but quit smoking. If you engage with alcohol, any level of alcohol today is getting flagged off, but most certainly if you're drinking more than 4 drinks a week, you're really in a high risk category. And third, red meat. Red meat is getting flagged off significantly. Other than that, air pollution. So be aware. I say be breath aware, be lung aware, be screen aware. That's the mantra. We really need to set out own screening. That's one very big way of early identification and prevention from advanced disease presentation. We really need to be aware of our body, of the symptoms, and if the symptoms are there, even for a couple of weeks, go to the right doctor, get the right screening, go to the right center, be aware, be screen aware.
Yeah. I think what I'm taking away from this conversation is there is no particular formula that leads to cancer, and there is no particular formula that leads out of cancer either. It's a combination of the right diet, the right physical exercise, and your genes and the environment that you live in. It's a combination and a complicated one at that. So don't take our word, go to the right doctors and let them help you fight cancer. And above all, like we always say, and our special campaign on Network 18 with Sanjeevani is to go out there, get yourself screened. There is enough and more help that can be provided. On that note, thank you so much, Dr. Limaye, for joining us.
Thank you, Sonal, for having me. And Sanjeevani, United Against Cancer, all of us should own screening. Go get screened.
Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.